1.
Good afternoon, everybody. My name is Barry Hudson. I am the Director of Public Information for Montgomery County. I'm sitting in for Lorna today, and today is our weekly press briefing. Today we have joining us as usual, County Executive Marc Elrich, Dr. Travis Gayles, our Health Officer, and Dr. Earl Stoddard, our Director of Emergency Management and Homeland Security. I want to remind reporters to please put your questions in the chat, identify your news organization, so that we can make sure we identify you. And if you need to request the ability to record, please do so. Also want to say just really quickly, happy Thanksgiving to those, and thank you for joining us today. So I will hand it over to County Executive Elrich to start us off with opening remarks.
Good afternoon, everybody. And again, I want to thank you for joining with us on Thanksgiving Eve. I'm going to guess that many of you, since we're all home these days, are making preparations for tomorrow. I know for me, it meant going out and finding a turkey that was much smaller than the normal turkey I would have gotten, and a mere one bag of stuffing. So it's I understand how much this holiday has changed little things like just food preparation. But I hope everybody has a good holiday. We're doing the press briefing today because this is a very serious time in our battle with COVID. And COVID is not taking the holiday off. That's really clear. And I think it's important we continue to provide you and the public with updates. Unfortunately, the number of cases in our county and around the state continue to be alarming. So far this week, our case count has remained high. Monday, we were at 213. Yesterday, we were at 233. Today, we're at 383. And if projections and concerns about the holidays are correct, starting around next Thursday, we should be looking at cases that are even higher than this. Our test positivity rate is 4.7. We've done, obviously, with the numbers like that, to be test positivity in that range, we had to be doing a lot of testing, and we've been doing a lot of testing in this county. Our cases per 100,000 is holding at 27.9, which is more than 4 times higher than it was just a little while ago. Monday and Tuesday, it was over 29. So our test positivity is still very, very high. I think 12 counties in the state have crossed the 30 cases per 100,000 mark. And last time I looked, there were a couple that had crossed 100 cases per 100,000 mark. So this is really deeply embedded in our community. And it's going to make for a really rough time until these numbers start coming down again. On the testing front, yesterday we tested over 4,000 people in the county. We've had over 19 testing sites going, and as well as our ready responders. And so we haven't had some of the long testing lines that you've seen throughout the regions, because we do have almost 20 testing sites going on a given day. That's been very helpful in keeping the lines down. I was up at Plumgar yesterday in Germantown and looked at the testing going on over there, and I was told later that they had tested 250 people there by the end of the day. And that was in cooperation with HOC, which has housing over there, and with the African American Health Initiative. So we were really health program. So we were really happy about that event. The virus is continuing to spread rapidly, and we cannot stop our fight. I've said this over and over again. I'm going to keep saying it until things change. So far, human beings are the only thing that can stop the spread of the coronavirus. We're it. There is no vaccine, and there is no treatment that's out there widely. And unless we change our behavior, or less than until we change our behavior, this virus is going to continue to expand. And the only way we're going to minimize these numbers is by doing the right things. This is why, we've modified our health orders. We really need people to hold gatherings to 10 people or fewer. that is critically important. And we need people to wear masks pretty much all the time when you're outside, whether you're going into a business or any kind of store, bar, restaurant, wherever you're going, you should have your mask on. And that includes, frankly, walking down a trail. Um, when people get used to not wearing masks, a lot of times it's something you grab for at the last minute. People run by you, you don't realize that, somebody coming up behind you isn't wearing a mask. Maybe you're not paying attention to the person, who's running toward you from a distance. And it is just simpler and safer to have the masks on, and it helps get us used to doing this. I do it. I haven't found it impossible to walk on a trail or even bike with a mask. So I think this is something that we really believe very strongly we need to do. And so that's why Dr. Gayles issued his health directive yesterday, which limited outdoor gatherings to 10 people and further amended our face covering guidelines. The medical professionals have also emphasized that wearing a face covering or mask protects both you and those around you. So if you're wondering why we're doing this, this is what the scientific evidence is saying is probably the most protective things we can do. Even if we maintain physical distancing, the mask is still important. And we're trying to reinforce that importance for people. When people leave their homes and they're required to wear the face coverings, and as a precaution, residents are being advised to always carry a face covering with them just in case they unexpectedly come in close contact with others. So I can't emphasize this enough for people. On Monday, the governor talked about the need for greater enforcement during the holidays. We're working with the state police to focus on areas in the county where people have historically gathered. And Dr. Stoddard's going to talk more about that later. But we cannot have parties going on in the county, particularly big parties going on in the county. This stuff has to stop. It's really not fair to the people that you're going to encounter. Everybody who's engaged in that has to remember that if you get sick, you may not know it for 4 or 5 days. And if the CDC guidelines that I've seen, or if I'm reflecting it accurately, they've talked about the first 4 or 5 days of this virus as being your most infectious period. So as much as it may be that people may think this is just an individual problem, because you're not identified as having COVID, that identification can take days. You may be comfortable with what you've done, but exposing other people to it isn't just not right. And so we're asking people, if you're not worried about your own health and safety, please be concerned about the health and safety of people around you. I know many of you saw my tweet that the governor didn't go far enough for the restrictions he put in place, and my suggestion that the state should go back to phase 1. I want to remind people that with our numbers that we have today, that's where we'd be. Nothing in the county would have been opened when COVID started with these numbers. Nothing. We wouldn't have talked about opening stuff up back in the spring if these were our numbers. We had to bring our numbers way down before we started opening things up. So we were already in a place where 8 months ago we wouldn't even consider being open, but here we are somewhat open, and we're trying to get people to take the precautions seriously, because if we're going to be open and stay open, this stuff has to be treated seriously. The county is not going to move to phase 1 by itself, because that's not something that we could do and be effective at. But I do think that if these numbers get worse, if the precautions that the governor took and the steps that we took are not sufficient to bend this curve, and if in fact we're faced with a curve that's going to continue to go up, then we're going to have to consider doing something, at least until the vaccines come online, more serious than what we're doing now. So I hope that the governor and the health officers around the state continue to look at the situation and continue to be willing to make adjustments that reflect the state of virus in our communities, because as hard as this season is going to be on everybody, and I know it's messing up holidays and it's messing up family get-togethers. We want to make sure that a year from now, when this hopefully is largely past us, that people really can get together and celebrate all these holidays and family moments together and do it with the whole family. And taking this seriously is part of making sure that next year is a better year than this year. We're going to continue to work with the other county executives and other jurisdictions around the state. I think you've seen that there's been greater alignment over the last couple of weeks as jurisdictions like ours, which had been in lower categories, have found themselves now in the higher categories. I think everybody's realizing that this is no longer a place where there are good counties and bad counties. They're pretty much all bad counties. None of us are in a place where we should feel comfortable with. And so we're continuing to do our work. And I think you'll see more cooperation from the executives even going forward. And I think we all realize that the more we work together, our residents are safer. So I want people to celebrate Thanksgiving safely. And, there are things to be thankful for. I'm thankful for the fact that, so many of our residents are taking this seriously. I rarely go out and see people without masks on. And it's good to know that people do take this seriously. I'm thankful that, so many of the people in our workforce have come to work and shown up, even when, all around us we're telling people, don't go to work, don't be in buildings. We've brought people into work and said, we need you. The county has things we really need to do. And the men and women who work for us have showed up for work and continue to show up for work. I'm thankful for that. And I hope the residents of this county are thankful for that, because if they weren't showing up, we wouldn't be making the progress we've been able to make today. And I just want to say again that, for months, there didn't seem to be any light at the end of the tunnel. And so asking for people's patience, and people kept saying, but patience till when? When's this going to end? I think we can see that, vaccines are in the pipeline and treatments are in the pipeline. So I think you can actually finally see a light at the end of the tunnel. And I think, what it requires now is for us to hang together, to continue to do the things we know will keep us safer, but be able to do it now with some assurance that if we can push ourselves through the next 3, 4, or 5 months, whatever it takes to get the vaccines out there, that we will turn the curve on this thing and be in a better place. But we've done so much to get us this far. We're just asking people to keep at it, stick with us, and help us get to the other side of this virus so that we can start resuming a more normal life for this. I'm confident that we're going to get through this. We just can't stop doing the things we've done to help us stay safe. So with that, I'll turn it over to Dr. Gayles.
Good afternoon and happy Wednesday to everyone. As always, a pleasure to be with you. Before opening remarks, given it's the season of Thanksgiving, I'd like to say a special thank you to a couple of groups. First, I'd like to say thank you to the tremendous staff of all of the different government agencies who have contributed to the pandemic response. I'd selfishly like to call out and highlight the team within the Public Health Services Unit, from our testing team who has stood up an apparatus that has grown in terms of diversity of how we offer and the capacity. As the county executive mentioned yesterday, just from the county apparatus alone, the different testing sites, we tested over 4,000 residents, which is by far a record compared to where we were. If you think back to those early days where we had very limited testing capacity, or our school health nurses, for example, who pivoted from providing healthcare services on a daily basis to children, to staffing our call centers and helping support our disease control team and the staff there who has continued to provide that outreach to communities, to the full spectrum of different folks who've also kept the regular public health service operations in play, whether it's our STI clinic, our TB clinic, our prenatal services, and our cancer control. So across the spectrum, thank you to everyone who's been involved and engaged in the response, because your collective efforts are what continue to move us forward and keep us safe. I'd also like to say a special thank you to echo the county executive's remarks about our residents. Our residents have adhered to the guidance that we've put forward, and we continue to ask for your patience. And even in your moments of COVID fatigue, we ask you to continue to adhere to the guidance that we've put forward, because that is going to be essential and key to us being able to move forward and keep you safe and hopefully turn these COVID numbers around. Now, the COVID numbers, that's a big topic of the day, and one that we hope people are talking about because it's extremely important. Now, the CE talked about how new directives have been put into place, or new levels of restrictions have been put into place. And at the same time, on a daily basis, we get lots of questions to say, well, why do I have to wear a mask? Or, why can't we change the way swimming is categorized and have more people swimming there, or different activities? I want to share with you some of the conversations we're having right now to hopefully resonate with folks at home to understand just how serious we are right now. In the last couple of weeks, as cases have increased incrementally in the beginning, but have certainly increased significantly in the last week, doubled in some instances, we've had to revisit conversations we had in the spring. For example, do we have adequate morgue space? In the spring, we had to order refrigerated trucks to be able to provide additional support to our hospitals. And based upon the numbers and the trends and how they move forward, and looking at the hospital data, because as you noticed in last week's press conference, we said, the hospital data is kind of lagging behind the cases. That's no longer the case. We are seeing comparable increases in our hospitals locally as well as across the state. And we know that if we see any semblance of the numbers from the spring, whether it's related to hospital utilization or COVID-related fatalities, we could potentially run out of space in our hospitals and our ability to be able to provide services to our residents, as well as run out of space to take care of those individuals who've unfortunately passed away due to COVID. So when people ask, why do we have to do these things, or why are we asking you to wear a mask? Why are we potentially asking you to curb the activities that are happening in our society? It's because we want to keep you safe. And we can debate back and forth on those merits, but understand those are the motivating factors behind what guidance we're putting forward, how we're continuing to work with our regional and state partners to come up and devise strategies to be able to keep you and your family safe during this time. But we also want to underscore that this is serious business. As the county executive mentioned, we have broken records in the last week, time and time again, in terms of daily cases. So much so, yesterday morning when I pulled the numbers and saw only, just shy of 1,700, I said, oh, okay, well, that's kind of a sigh of relief. It wasn't as bad as 2,800 or 2,300 that was reported the week before. But just think back, less than 10 days ago, a day of 1,700 cases would have been third or fourth highest daily total of cases across the pandemic. And so if I'm sounding bleak or sounding concerned, it's because we are. And we certainly continue to be concerned, as the county executive mentioned, given the record number of folks that we're seeing traveling during this holiday season, in spite of the guidance that we've put forward from the state, the federal, and the local level, discouraging travel as much as possible. This is why we are requesting and asking that folks limit your interactions with folks outside of your household, because we don't want to have a different conversation next week where we're talking about even higher numbers of daily cases, higher numbers of hospitalizations, and God forbid, higher numbers of COVID fatalities. So this isn't meant to scare you, it's meant to level set and share with you the reality of where we are in terms of devising our response, and hopefully raising a keen sense of awareness in the community to get that this is really serious. And I would just like to end, and as always, open to answering questions, is we continue to also be thankful for working with our partners in the healthcare system, and again, across the region and across the state as well, as we continue to work together to implement strategies to keep our residents safe. Thank you.
Okay, I'll go next. And so obviously following Dr. Gayles is always a challenge, and I'm thankful for his partnership every day. So I appreciate very much the words he has to say. So Dr. Earl Stoddard, I'm the Director of the County's Office of Emergency Management and Homeland Security. I have a few updates today. I want to focus on education and enforcement because I know that's been a topic of the governor's emphasis, but I also, it's been a focus area of the counties for a long period of time. So I want to highlight some of the things that we have done. As we discussed before, our Department of Health and Human Services, particularly our Division of Licensure and Regulation, has been working very closely with our Alcohol Beverage Services Department to do much of the education and enforcement that we've been doing as a county. We have ramped up those activities over the last couple of weeks, and we'll continue to ramp them up. We're bringing in additional support from the Department of Environmental Protection, Department of Housing and Community Affairs, Department of Permitting Services, Department of Transportation, and our Animal Services Division as well to support and expand the ability of the county to do both education and enforcement. We realize that the vast majority of businesses are doing exactly what they should be doing, but we continue to see places where, through, either for lack of knowledge or lack of self-enforcement, we're seeing violations. Over the course of the pandemic, we've had more than 30 citations issued of about $500 a piece to businesses. We've had 7 businesses that were either temporarily closed or had their operations suspended for a period of time. We've had 2 businesses that were closed for extended periods of time via health order during the pandemic. We will continue to take this very seriously. We are also integrating our law enforcement partners as well. As the governor has alluded to, the Maryland State Police will be out doing enforcement in partnership with the Montgomery County Police Department in high traffic areas. For example, they will likely be out tonight in the Silver Spring, Bethesda, and potentially Gaithersburg areas where we have a high density of restaurants and other congregating locations where members of the public are likely to be the night before Thanksgiving. And so obviously they're going to be out there to make sure that things are being done safely per what the governor has directed. There are multiple avenues that people can report issues, whether it be private gatherings or in businesses. We encourage people to continue to provide that information because we're responding to those on a regular basis. So for gatherings in private locations that people are concerned about, they can call our police non-emergency line, which is 301-279-8000. If you have a general concern or something you want to see raised in the business, you can notify either through 311, the HHS licensure and regulatory phone number, which is 240-777-3986. Or finally, the state has set up a Prevent COVID call line, hotline that operates 24 hours a day. That number is 1-833-979-2266. We encourage our residents to make things be, we're going to go out and we're going to talk to businesses again where we don't find egregious violations, where things can just be approved slightly. We'll just issue warnings and do education. And so you don't necessarily need to feel like you're, ratting people out or anything. We're going to try and work with businesses who are working with us to try and keep things safe. Only in places where we find really egregious violations are we really jumping right to a citation right away. More times than not, a citation is for a repeat offender or someone who is so egregiously ignoring our rules that we have no choice but to issue a violation. And so just want to make sure that that's clear. Very much I want to echo the things that Dr. Gayles talked about over the last week. We've also done some additional education with other non-business partners. We had a Houses of Worship webinar that we did yesterday, and on Friday we did a webinar with our business community going over our ventilation and filtration guidelines with some experts that have helped provide us feedback on those guidelines to talk about how businesses could implement some of those measures as well. So I will stop there.
Okay, actually, Dr. Stoddard, could you give those numbers, telephone numbers again?
Sure. So for any, on private property, police non-emergency line for Montgomery County Police Department is 301-279-8000. The state COVID reporting line, which is open 24 hours a day, is 1-833-979-2266. And our HHS licensure and regulatory can either be reached by calling 311 or calling them directly at 240-777-3986. 3986.
Thank you
There's
very
also
much.
a portal on the website that has all, to report a violation, it has all those numbers on it as well.
Thank you, Dr. Stoddard. We'll go to reporter questions, and our first question is from Chris Gordon, NBC4. He has a question for all three.
Yes, Dr. Stoddard, you started, well, you addressed this to some degree, the kind of citations and enforcement you've had in the past. As we all know, there are a large number of college students that traditionally go out on a Wednesday night before Thanksgiving. There are bars and restaurants that now face state and county restrictions, closing at 10, being one of them, and the capacity at no more than 25%. So if you can, to some degree, tell the public, the students who are going out tonight, and the bars and restaurants, what they face tonight if they don't adhere to these state and county restrictions.
Sure, we're expecting to have good partners in our restaurants and in our public. And so, number one, we have as we updated to yesterday, we have a face covering requirement. We have distancing requirements inside our restaurants and bars. Obviously, the state has required that those bars and restaurants be closed at 10 p.m. And our rules require that you minimize the number of people to 25% with all the distancing. And so, with the exception of when someone is consuming food, not just when you're sitting at a table in a restaurant, you should be wearing a face covering. You should be respecting the rules that the restaurant has put forward, and we're going to have teams out there doing enforcement to ensure that happens. If we find that a business or a restaurant is willfully ignoring the rules tonight or any other night, the first offense would typically issue a warning. However, in cases where it's a repeat offense or the violation is significant, we will issue a $500 citation. If we find instances where there is a multitude of violations occurring all at once, so not wearing a face coverings, too many people, not distancing, all of those things at once, there is the possibility that under Dr. Gayles' authority, a particular business can be closed down for a period of time up to and including the length of the pandemic. And so that's sort of the ultimate last thing we want to do. We understand how much the businesses have been struggling. We want them to be successful. We want people to be safe. But we, obviously have these rules in place for a reason, and we're going to ensure that they're followed.
Thank you. Thank you.
All right. Our next question is from Caitlin from Bethesda Beat.
Hi, I just had a clarifying type of question about the mask guidance. So I know previously, before the new guidance was released yesterday, it was recommended that people wear masks outdoors when they couldn't socially distance. And so I'm just trying to understand the difference between what was in place before and what is in place now. Can you just speak to that for me, please?
That question directed to Dr. Gayles?
Yeah.
Okay.
Okay. I think we all can chime in on it, but thank you for your question. I think the most important thing is that we're asking people when you go outside to wear a mask. It's a small nuance from what we asked before, and there is a separate release that has been put out to give further details in terms of if there's situations that may call, if you want to call them exceptions to, exceptions to the rule. We pattern this identically to the DC order that was put into place several months ago. Again, the expectation is with community transmission levels where they are right now that are clearly high, to the county executive's point earlier, when we were at a comparable stage before, and I would argue we haven't really been at the stage before because we're seeing much higher numbers than we had experienced in the state the first time around, everything was closed. And so we did not have folks interacting, or if we did, there was on an extremely limited level. Since then, we also have learned that, there is the potential for asymptomatic transmission. Hence, we put in those mask mandates, or however you want to call it, in terms of requiring people to wear face coverings. Now, given that we're seeing these much higher numbers and certain aspects of society continue to be open, we're trying to utilize all of the different tools within our public health toolkit to be able to stem the tide of increases in cases. And so that's why we again, a slight nuance to say we're asking people to wear, when you step outside of your house and you're walking around and you're in public, to wear the mask. Now, we've received lots of questions and some, more extreme examples to say, I'm at home in my backyard. You're at home in your backyard by yourself, or you're with your family, who you're with. That doesn't necessarily apply to this. It's applying to when we're coming into spaces where we can interact with other people. Again, I know that there is a press release that is going out to provide more detailed language about some of those exceptions. I would encourage you, in the interest of time, I don't want to walk through all of those, but I would encourage you to take a look at that, as it's an excellent source to provide more details and insights to our intentions for those to follow along at home.
Yeah, I would just add that examples of where we've seen inconsistent compliance are, for example, particularly in the downtown areas, or a really good example that I've seen personally is around the boardwalk around the Rio in Gaithersburg. People are interpreting the quote unquote maintain 6 feet of distance as being I'm spending 6 feet away from people most of the time, and therefore I don't need to wear a face covering. We're trying to remove some of that discretion to say what exactly is most of the time. If you're likely to interact with someone at any point during your walk outside, you should be wearing a face covering. So, for example, I walk daily around Lake Hollowell and Olney, and I wear a face covering while walking. I may only interact with 7 or 8 people during the course of a 45-minute to an hour-long walk, but now I'm, basically saying I'm likely to interact with people along that walk. I should be wearing a face covering while doing it.
Thank you.
Okay, our next question is from Rebecca Tan from the Washington Post for Dr. Gayles.
Thank you, and thanks for having this the day before Thanksgiving. I have 2 questions to do with, the spread of the virus primarily. The first one is really straightforward. Has the county seen any cases or clusters associated with the rallies that were conducted in support of President Trump a few weeks ago?
Not that I'm aware of. I don't have or haven't been provided any information to link a cluster of cases to those events.
Got it. And related to that, I'm wondering, Dr. Gayles, if you can tell us a little bit more about what you're seeing in the contact tracing data. Both you and the county executive mentioned that, cases are really leaping, right, in the past couple of weeks. And what is driving, what kind of activities and what kind of settings is driving that increase? We knew, for example, in the spring that we were seeing big jumps in cases at nursing homes, for example. So what is the situation now? What is the contact tracing data suggesting?
Another great question. I would clarify my answer to the first question to also say that, in terms of contact tracing data related to those rallies, if there were a significant number of participants who were residents of other jurisdictions, we may not know necessarily of those cases, but I can say from Montgomery County residents, we did not see, as best as I can tell, any of our residents tied to that coming up positive secondary to that. I can't speak to other jurisdictions who may have had residents participating. But in terms of the contact tracing piece, what is becoming very evident is one of the challenges is when the numbers increase to this level, it becomes increasingly difficult to identify, smoking guns for each particular setting. As you mentioned, we saw nursing homes were a significant source the first wave, but now we see such widespread community transmission that when we do get contact tracing data, we are seeing that certain activities, for example, working outside of home, is a risk factor for COVID exposures. And we know that, unfortunately, based upon the types of jobs that we need to stay open that are deemed essential to keep our economy running and to provide us the services we need, we do see a large percentage of those communities who've been hit hardest by COVID-19 also falling into those categories due to their economic realities, the need to continue to work and provide services, as well as not having the luxury of being able to telework from home or have paid leave should they become ill or a family member require assistance. We have also seen continued instances of large gatherings, both formal and informal. Hence the tightening of capacity limits around those types of gatherings, those social gatherings. And we've seen that addressed across the state in a number of different forms to address that issue. We have seen the percentage of positive cases who have been in a house of worship during that infectious period increase as well over the last 2 months. And so, some of the other things that continue to come up, indoor dining, as well as indoor types of activities, and to a lesser degree, but still on their outdoor activities as well, particularly where there have been larger capacity limits in terms of those participating and less adherence to the physical distancing guidelines. And we also, just as a note, we also continue to and I'm going to put Dr. Stoddard may be able to actually show you what we presented to our houses of worship yesterday. So I'll let him work on the tech piece from that. We also have seen, we continue to get cases. For example, what's popped up in the last month or so is, an increasing number of cases and outbreaks associated with youth athletic activity, particularly around club sports activities. And we've continued to investigate those cases. And also to a lesser degree, we have continued to investigate a number of cases related to the schools that have been open during this time period.
Yeah, I'm going to, Rebecca, I'm going to show some data. I think this will be relevant to everyone because I think it's worthwhile showing. This is what we shared with our houses of worship at the session that we had yesterday. And I think just to make sure that for context, so this actually is a report. So we get a weekly report from the state of Maryland that's generally a cumulative report, meaning, it's added on to each time. And so this data is data we received back in August, and I'll contrast it with the data we received last Wednesday. I don't think we've received this Wednesday's data yet. So today we'll get more data on this. This is where we were at last August, and this is the breakdown that the state typically has around high-risk gatherings and high-risk locations. The first thing, Dr. Gayles has talked a lot about the family gatherings and house parties and other events. You see where religious services are. You see where working outside the house is. Those are all things that Dr. Gayles mentioned. So this is what it looked like back in August. This is the cumulative report from last week, and I'll let you compare and contrast some of the things, and we can go back and forth if you need. But you'll see we've seen a reduction in the contribution of family gatherings, but we've seen an increase in religious services. We've seen an increase in working outside the house. We've seen what you would expect, a decrease in outdoor dining, an increase in indoor dining. But as you can see, and I'll show one last slide and we can go back and forth between these if you like. This is the data from just the last week, so the 8th through the 14th. And what you can see here is it's pretty consistent over the last week with what we had seen before. Few limited exceptions. More indoor dining than outdoor dining, as you would expect from the transition of people moving indoors. Less outdoor dining as less outdoor dining is being done. But this tells you that it's not one particular smoking gun, as you refer to it as. It's a across the board increase in cases in all areas with association with all activities. So hope that sort of gets more to the question that you're trying.
Mm-hmm. Got it. And these numbers, this 61%, for example, that I'm looking at right now, what does that, that's percent of responding cases say that they work outside the home? Is that right?
Yeah. So basically, so this is actually, so I'll explain this a little further. And this is why, we haven't, this data requires a little bit of an explanation. So basically cases that come into the state of Maryland this is for Montgomery, the cases that come in the state of Maryland, they do the initial contact tracing with this assistance of local public health. They ask people a whole series of questions about what kinds of activities they had done. And so 42%, I believe, was the most recent number, maybe 42 to 45% report having been to a high-risk location, at least one, they may have multiple, And I think 12% of the last 12 to 15% of our cases have reported into a high risk gathering. And then of the gatherings, this is the distribution of the high risk locations. So 42 to 45% have been to a high risk location, and of those who reported having been to a high risk location, 61% worked outside the house, 35% had indoor dining, indoor retail, et cetera, et cetera.
Got it. And so we have actually, sorry, I know this is sort of being finicky here, but we have more than half, 58% of people who haven't been to a high risk location and possibly have no idea where they got the virus. Is that right?
Right. Yeah, I think it's something, yeah. I'll let you, Dr. Gayles, you can talk.
No, I was just going to say, and that underscores the concern from, we have such significant levels of community transmission, which is why we've put in and implemented strategies across the board. It would be easier if we had one activity or one type of venue that we knew was the sole source of this and we could shut it down and close it down. But it's the challenge. And that's why we continue to try to think through different strategies that would be most impactful to be able to drive the number of cases down. But as you can see, there's lots of different potential places that contribute to cases and put people at risk. And we try to utilize the data as best as we can and as specific as we can to make sure that guidance is as focused as we can to have the greatest impact.
And I would also note, and the governor noted this in his commentary, that the N number that you can see here is 1,512 cases. We had more than 1,512 cases over that week-long period, which means that a number of people refused to participate in the contact tracing effort. And so we have no data for where they might have been exposed, where the numbers would be if we had 100% of even our known cases. And then obviously, there are many more people who are infected than we even have reflected in our testing. So it shows you the challenge in doing contact tracing when at every step of the way, you don't test everybody. Only those people who test positive can you even ask. Some number of those people refuse to answer. Within the people who do give answers, they give a plethora of different locations that they've been. So it's hard to say this person got exposed at this location because they may have purchased, very many people had multiple answers, meaning worked outside the house. They also visited a restaurant. They also went to the grocery store. And so it's very often very difficult to say this person got exposed in this location unless you identify them as part of an outbreak investigation like we do in, for example, our nursing homes or in our schools or something like that.
Got it. All right. Thank you. Thank you guys so much for this.
Okay, last call for questions. Going once, going twice. Okay, that's it. I want to reiterate, thank you all for coming out on Thanksgiving Eve to join us for this. And we want to say to the people at home, as well as all of you, have a wonderful Thanksgiving. Be very, very safe, and continue to be vigilant and mask up. Thank you very much.
Happy Thanksgiving.
Thank you all.